This is Caroline, the emergency department admitting nurse, dictating the nursing history and assessment of Joe. Joe arrived at the emergency department today via ambulance. His wife and grandson are en route. He is alert and oriented, anxious, and in respiratory distress. His blood pressure is 180 over 90, pulse 120, respirations 30, temperature is 102 orally. He's on oxygen at 4 liters, 88%. Lung sounds have crackles in the bases. He is using accessory muscles to breathe. Pursed lip breathing and orthopnea is noted. He has circumoral cyanosis. His skin is warm and moist to touch. His lower extremities have 1 to 2 plus pitting edema. He is noted to have a 5-pound weight loss since his last hospital discharge 10 days ago. His chief complaint today is increased difficulty breathing. Some associated symptoms of chief complaints include intermittently feeling warm for 3 days, sleeping in his recliner for the last 2 nights. He's also having difficulty catching his breath, has a mild headache, no energy, an increased cough, as well as his sputum production is yellow in color. His past medical history includes hypertension, type 2 diabetes, COPD, and GERD. His family history is that he lives at home with his wife and his grandson of 6 years. The grandson is 6 years old. He has 1 daughter and son-in-law. Both are in the Army currently and deployed overseas. His grandson has a recent upper respiratory infection, and he is newly diagnosed with asthma. There are no pets in the home. His social history includes he is a retired factory worker. He likes to garden. He smokes 1/2 pack of cigarettes, which is down from a full pack per day. His present medications include atenolol, 50 milligrams by mouth once a day, furosemide by mouth, 40 milligrams once daily, Protonix, 40 milligrams, PO daily, Flovin inhaler, 2 puffs daily, twice a day, albuterol inhaler, 2 puffs every 4 hours to every 6 hours with cough and wheezing. His lab and diagnostics are ordered, which include a chest x-ray, ABGs, a CBC, and complete metabolic panel. The chest x-ray showed a left lower lobe pneumonia, WBCs 21 with primarily neutrophils and few bands. ABGs, his pH is 7.25, PCO2 65, PO2 62, and his HCO3 of 33. Joe has improved while on receiving respiratory treatments in the emergency room. He also received Tylenol, which did bring his fever down. We initiated antibiotics, and he is being admitted to the respiratory care unit with a diagnosis of COPD, exacerbation, and pneumonia. Now, what I'd like to say is to ask a couple of critical thinking questions. Based on the above findings, list 2 nursing diagnoses with related interventions.